Hello, my peers. As you all know, my name is Joe Poor. I'm an RN, BSN, and a graduate student at National American University. Today, I will be presenting an in-service to you all called the Assessment of the Suspected Acute Appendicitis on this date, November 17, 2017. The purpose of this video is to allow you, the outpatient nurses, the opportunity to gain knowledge and information about appendicitis, the clinical manifestations, signs and symptoms, assessment techniques, diagnostic approaches, treatments, and nursing interventions needed to care for these patients. The learning objectives for this in-service are to give you better understanding of the signs and symptoms of appendicitis, understanding the evidence-based techniques used to assess for appendicitis, how to assist in coming to a diagnosis of appendicitis, and nursing interventions needed to care for these patients. Appendicitis is one of the most common reasons for emergency surgeries around the world, according to Ali, Sayer, and Phil. Patients that come in with appendicitis usually have signs and symptoms of any of or in combination of low-grade fever, nausea and vomiting, diarrhea, rectal tenderness. Though it should be noted that the severity of appendicitis depends on the degree of inflammation, according to Al-Makbil. One of the most prominent signs of appendicitis is abdominal pain, spreading from the right iliac fossa to the umbilical region, according to Al-Makbil. Ali et al. Suggest that the para-umbilical pain is from the obstruction of the appendix, and the iliac fossa pain is caused by peritonitis. A thorough assessment should include characteristics of the abdominal pain. Al-Makbil suggests that pain characteristics can help in determining appendicitis, which usually manifests pain consistent with sharp or tearing sensations. Included in pain is severity and duration from onset. Other assessment findings could be a weight change caused by anorexia. Changes in bowel habits as well is commonly noted. Bowel habits usually change in the form of diarrhea, which could account for the rectal irritation. It should be noted that the right iliac fossa pain is not as evident in children, but they can manifest all the other symptoms. That is according to Ebrel. A simple assessment test used to help aid in the diagnostic of appendicitis is checking McBurney's point. In one study, it was found that all patients that had a positive diagnosis of appendicitis had the maximum tenderness at McBurney's point. McBurney's point is located at the point of the right lower flank, midway between the iliac crest and the belly button. Here's a picture of the abdomen, and here you can see the iliac crest and the belly button. And a third of the way above the iliac crest and the belly button is McBurney's point. McBurney's point may also be accompanied by a rigid abdominal wall on palpation. This area is known as the retrocecal appendix position and is the most common position of the appendix, according to Ali. Another sign of potential appendicitis is elevated white blood cell count above 10,000, according to Ebel. Diagnostic tools used to find definitive appendicitis is either computed tomography, CT, or ultrasound. According to Ali et al., CT is more reliable in reducing the number of false positives. Al-Makbil also echoes this finding. Ebel suggests that 70 to 90% of all diagnoses confirmed during removal from CT, which leads to believe that even a CT is not 100% positive because anywhere from 10 to 30% are still getting their appendix removed. When they go in there, there's no evidence of appendicitis. When appendicitis is suspected and confirmed through a diagnosis, there's only one treatment: surgical removal. There are two different methods of removing the appendix. The standard open appendectomy, which involves an incision about 5 centimeters long. A laparoscopic appendectomy uses approximately 3 1-centimeter incisions to take out the appendix. According to Al-Makdil, laparoscopic removal is the treatment of choice as there is less complications and faster recovery because of less incision. Once a diagnosis is made, nursing intervention would be include prepping the patient for surgery. This is considered an urgent surgery, so prepping needs to be done fairly quickly. Other interventions are to provide emotional support, keep the patient NPO. Postoperatively, nursing intervention would be to provide pain control, to get the patient up and moving as soon as possible. This is to help with peristalsis and to prevent blood clots. Controlling nausea and vomiting would be a must in the immediate postoperative area because vomiting could cause pain and the incisions to dehisce. Start the patient on clear liquids as soon as possible or ice chips as soon as a surgeon orders, according to Ebel. This has been an in-service to help guide you in the treatment and assessment of patients that present with suspected appendicitis. We covered signs and symptoms, diagnostic tests used to confirm diagnosis, and treatment options for appendicitis. We also discussed current nursing interventions that are applied to those with appendicitis. This concludes our in-service. I would like to thank you for your time.